Hi, everyone. I'm Dr. Betsy Boudreau, and I'm a chiropractor in Victoria, Texas. And I take a special interest in providing structural care for moms and children in our community. But I also find a lot of value in nutrition for the body so that it can function properly and optimally. I'm in the midst of obtaining further education in functional medicine, so today I'm only going to focus on the nutrition side and not so much the biomechanics for the body. I'm going to quickly highlight what I discuss in the office with patients during a nutritional consult. Reviewing past blood work and getting updated labs is also something that I do. So when a patient comes in trying to become pregnant, the first thing that I like to mention is increasing your nutrition at least 6 months prior to even trying to conceive. Easiest way to flood your body that makes the connection of what we aren't eating and what we should be eating is a multivitamin or a prenatal. And I hands down only recommend whole food based products. And while I have more than one whole food based product in my office, only one actually carries a nutrition label instead of a supplement label. And that same one is the only one that's backed by peer-reviewed published research. Gold standard testing that actually proves the nutrients is 100% taken up into the body to be utilized and shown to actually improve the quality of health, which is Juice Plus. So this right off the bat will take care of most everyone's deficiencies that they're suffering from. Conceiving may be longer too if someone's also taking a birth control medication or really anything other than a family planning method. Altering hormone levels or your mineral balance, especially if staying on a birth control for years at a time, is detrimental. Most don't know what to look for in the short term for symptoms and only see the bigger picture whenever it's too late and they're in higher risk for cancers because the body's been out of balance for so long. So that's definitely something to look into if you are currently on a birth control of some form. Alcohol intake will also deplete nutrients in the body. That's something that we discussed. Too much or too little physical activity can cause deficiencies or imbalances that make conceiving difficult. And finally, sleep habits are also essential to creating a healthy environment. So whenever we discuss these topics in the office, I think it's important to note that the father is also a big part of this. Several of these factors are just as important to him to ensure a healthy outcome during the birth process. And he should also be considering, adequate nutrition intake and all these other factors. So then the magic happens, right? God gives you a little blessing of a pink line, and now what? Well, we keep doing everything that I just talked about, okay? But then in general, I recommend that you should be eating at least half your plate filled with fruits and vegetables. So 50% of that food intake should be a fruit or veggie source. 2 vegetables and 1 fruit is an easy go-to, and then a protein source. Also avoiding your white food category, so dairies, refined sugars, your processed fruits and grains that have been altered. Avoiding those will help to minimize that inflammation and swelling in the body during pregnancy. And then that protein, it's very vital because we're laying the foundation for your DNA and RNA right now. I think quality really matters across the board for your protein source. So at minimum, you should be working towards 80 grams of protein and then up to 100 grams if you're actively working out at least 4 to 5 times a week. Lastly, water intake should be at least half your body weight in ounces. 20 ounces should be added to that for every 30 minutes of exercise, and you should also be adding in another 16 to 20 ounces if you're currently breastfeeding. So I've personally been taking the Juice Plus product for the last year and a half, and as of right now, it's my sole prenatal along with their complete protein shakes for added protein. I have all of the confidence because of the quality of research done at prestigious institutions, third-party universities, things like that. And it's showing that, the benefits to it are second to none to any other product out there. I want to close with giving you something to think about. It's pretty deep. This really hits hard for me because none of my grandparents lived long enough to even see me graduate high school. Many in my family have also been diagnosed with cancer, and some have not been fortunate enough to survive. My maternal grandmother and my mother have a history of smoking, And then finally, I lost my first child to a genetic disorder at 10 months old. So I leave you with this. At 17 weeks in utero, if you're having a little girl, her uterus and all of her eggs that she'll carry are fully developed already. They don't begin developing at 17 weeks, they're fully developed. So before you can even feel her kicking or moving properly, her reproductive organs are already completely intact. So what we do right now for our health and our children is also going to impact our grandchildren. Okay, so take that into consideration. So I hope you found some of this information valuable and that you're able to implement it into your daily lifestyle. I'm always available for questions. You can reach me through my office Facebook page, New Life Family Chiropractic, or even my website, victoriatxchiro.com. Thanks.